Hello, our topic for today is what has been on everybody's mind, which is the No Surprises Act and the good faith estimate. So just want to give a disclaimer that I am not an attorney. I am a private practice consultant and I have not, I've done research, but what I'm telling you is more of our experience and what we're doing as a group practice, and shedding some insights into what you can do to make sure that you're being compliant with this new act. So basically, what I understand from this is that we have to provide any client or potential client, so old or new clients or potential new clients that request one, a good faith estimate, which means that as mental health providers, that anybody that is utilizing private pay or out-of-network benefits, that we have to provide them with this estimate, and that we are being told to do it for a 1-year period of time. And so there are certain things that you need to include on this good faith estimate. You need to include information about yourself, so your name, your location, your address, your tax ID number, and your NPI number, and then information about the client, their name, address, email address if you so choose, their date of birth, their diagnosis if they have one. You do not need to include a diagnosis if you haven't given them a diagnosis yet. You can always update your good faith estimate when you do diagnosis or do provide a diagnosis. And also the charge. We're doing it based on service code, so intakes and follow-ups, and we are doing it for a year, and we are tallying that number up for clients. I will talk a little later about I think I might do another video actually on whether this is going to scare people or how we can manage this as private practice owners. But ultimately, yes, we are providing these. We sent these all out to everybody that is private pay coming up in 2022. I think we sent out like 200 or 300 letters already. We are not requiring a signature. There's been sort of like some debate as to whether you need a signature or not. We didn't decide to require a signature, but what we did do is we uploaded this to our portal on TherapyNotes and sent it to the client so that there was a way that the client would be able to see it through their portal. And then we also had record that this was sent to them. And so this is going to be really important for anybody who is a private pay therapist, even if you accept insurance and you're billing out of network, or there are other things that you are, doing that is cash only, like evaluations, immigration evaluations, substance abuse evaluations, anything that is not run through insurance. Now, there is some talk that maybe we would have to provide an estimate for insurance-based services in the future, but that hasn't rolled out yet. So I'm blind to it. I'm not thinking about it. I'm closing my eyes. I'm shutting my eyes. I'm not thinking about that yet. I understand that may be coming down, but for now we are providing this. We sent out, or we're getting ready, actually, we haven't done it yet, an email to everybody on our email list to include our clients that they should have received a good faith estimate and that we will be doing this moving forward, just so people understood what they were receiving. And we let them know that that was not a bill, and that if they had any questions that they could get in touch with the office manager. So then that way we were able to mitigate any issues that came up. So yes, we are providing good faith estimates to current clients and any new clients that are paying private pay out of network, and anybody who requests it, even if they're just shopping around. I'm going to talk about how you can get this accomplished, but first I want to thank TherapyNotes. If you're looking for an electronic health record that is really full service, that can help you with all of these kinds of things. We uploaded our good faith estimates in TherapyNotes, sent it to our clients. It was so easy. We send our paperwork through there. We take payments through there. Their credit card processing is really competitive, so it makes it so easy to integrate everything. They have a free telehealth option. And what really makes TherapyNotes stand apart is their customer service. So be sure to check out TherapyNotes. So you are going to need some administrative support, whether you do this yourself I was thinking if I was in a solo practice and I needed to provide this to all of my clients, I would do it maybe the last 5 minutes of the session and say, hey, I need to provide you with a good faith estimate. I'm going to input all of your information. I'm going to provide you one right now. I'd print it out and give it to them. So there were no issues. If you have an office manager or some kind of virtual assistant, I would utilize them. And if you're running a group practice, you are going to want to think about how you can do this moving forward. We created a template. We pulled all the data directly from TherapyNotes. What I love about TherapyNotes, I'll be honest, is that I was able to pull all the client records so easily, and we were able to do a mail merge. So we didn't have to just copy paste. It was really easy utilizing the tools that TherapyNotes has to then aggregate all of this information. So it was laborious because there were so many of them. But if it was a solo practice or even a smaller group practice, it may have looked differently. So if you have any questions about the good faith estimates, please post them below. If I don't have the answer, I'll be happy to guide you. TherapyNotes also posted a blog post about this with some information. So be sure to check this out, and just know that the feds are not going to be knocking on our door tomorrow, saying, well, you forgot this box or you didn't do this. We want to make sure that we're managing our own anxieties about this and know that we put our best foot forward in implementing this, but it is going to be a period of adjustment for everybody involved in this. So just know we're all going through those growing pains together with providing these, especially since it was really such short notice. I understand that maybe this was in effect, but nobody was really talking about it. And then all of a sudden now it was being talked about in Facebook groups, which we're lucky, but I'm wondering about the everyday therapist who maybe isn't in these Facebook groups and if they're getting this information. But anyways, I'm here most days to answer your questions. I'll see you soon, everybody. Bye.